Hi, good day. My name is Valentine Akaba. I'll be making a presentation on the role of emotion and motivation in panic disorder. And for these presentations, I did something in each of the slide, which is to highlight, key points of each of the slides with regards to panic disorder. So, first I have to give like a brief summary of panic disorder. So, panic disorder basically like embodies recurring panic attacks and persistent fear of future episodes. Emotions plays a central role here, and as fear is the dominant emotional experience. Motivation is also affected as individuals often become driven to avoid situations or sensations associated with the panic, which unintentionally maintains the disorder and creates a cycle for the disorder. And some of the key points are recurring, unexpected panic attacks, constant fear of future panic attacks, strong emotional and motivational reactions, avoidance behaviors that reinforce symptoms. On the second slide is talking about physiology of panic disorder. Um, Physiologically, panic disorder, panic attacks activate intense bodily responses such as rapid heart rate, shortness of breath. The amygdala in this situation interprets these sensations as dangerous. Even when no real threat exists, this misinterpretation increases fear and escalate panic symptoms. And in this situation, some of the key points here are increased heart rate and breathing, muscle tension and dizziness, increased amygdala activation, and misinterpretations of body sensations. And on the next slide is the sympathetic and parasympathetic nervous system. Um, uh, the sympathetic nervous system becomes overactive during panic situations or panic attack situations, preparing the body for action. At the same time, the parasympathetic nervous system, which normally calms the body, is less effective at this time. This imbalance explains why panic symptoms feel overwhelming and difficult to stop for clients or individuals who struggle with panic attack. And some of the key points for the sympathetic and parasympathetic nervous system is the sympathetic nervous system activation, parasympathetic nervous system suppression, reduce autonomic regulations, and prolonged physiological arousal. And our next slide is talking about neurotransmitters and hormones. Um, Several neurotransmitters are involved in panic disorder. There's increased norepinephrine, heightens arousal, while the reduced GABA limits the brain's ability to calm itself. Cortisol releases through the HP axis, which increases sensitivity to stress and anxiety. And some of the key points here is the key neurotransmitters and hormones are norepinephrine, serotonin, GABA, and cortisol. And on the next slide, we're going to talk about the fight or flight and freeze mode. The fight, flight, or freeze responses is usually meant to protect the individual from danger. In panic disorder, this system is activated unnecessarily. Fear motivates escape behaviors, and repeated avoidance strengthens panic responses over time. And this becomes a cycle. And some of the key points are the automatic survival response, triggers without real danger, fear-driven motivation to escape, and avoidance reinforces these panics. Next slides, we'll be talking about potential causes of panic disorder. Panic disorder is usually caused by a combination of biological and vulnerability, biological vulnerability, such as genetics and also learning experiences, anxiety, sensitivity, Fear of body sensations play a major significant role, especially when stress triggers the first panic attack. And some of the key points here are genetic vulnerability, anxiety sensitivity, learning and conditioning, stressful life events as some of the core key points here when we talk about causes of panic disorder. On our next slide, we'll be talking about the comorbidities of panic disorder. And, panic disorder frequently co-occurs with uh, different comorbidities such as depression and other anxiety disorders and substance use. These comorbidities can increase emotional distress and reduce motivation for treatment, making integrated care extremely essential. And another aspect of this also is agoraphobia, which is commonly present and promotes functional impairment. And some of the key comorbidities here is major depressive disorder, generalized anxiety disorder, agoraphobia, and substance use disorders. Onto our next slide. Which is evidence-based psychological treatments. Cognitive behavioral therapy is the most effective psychological treatment. CBT often addresses distorted thinking, emotional responses, and avoidance behavior. Exposure therapy here helps retain emotional and motivational systems by reducing fear responses. And interventions that utilize exposure-guided modalities may minimize fear by retaining emotional and motivational responses to body sensations. And some of the key points here are cognitive behavioral therapy, key treatment modalities are cognitive behavioral therapy, exposure-based interventions, psychoeducation, and skill training. And on the next slide is medications for panic disorder. Medications such as SSRIs and SNRIs help regulate neurotransmitters involved in panic situations. Benzodiazepines can reduce symptoms quickly, but are typically limited due to its dependency risks. So usually the guideline here is to not use it for long term, but for short terms. So combining medications with therapy produces the best outcomes in these situations. And some of the key points here is SSRI and SNRIs. Benzodiazepines for short-term use, medication combined with therapy are most effective. And onto the next slide is therapeutic techniques and support systems. Therapeutic techniques include interoceptive exposure, which helps clients tolerate bodily sensations and cognitive restructuring to challenge catastrophic thoughts. Um, Support from family also and peers of such clients also enhances motivation and treatment adherence. And motivation can be improved by having collaborative goals with a client and encouraging efficient personal approaches, basically being independent in applying modalities and interventions that helps. Some of the key points here are interoceptive exposure, cognitive reengineering, breathing and mindfulness activities are very good as well, and social and family support go a very long way to address these situations. So on to the next slide is about cultural and population considerations. Treatment in this situation must be adapted to different populations. Cultural belief influence how panic is understood and expressed. And children benefit from family involvement, while older adults may need coordination with medical care providers. So you will be working with a multi-treatment team in situations like this, and those are very helpful. And some of the key points here are cultural beliefs about panic, age specification adaptation, so you're talking about like children and older adults, and family involvement when appropriate, as you we need to ensure that there's releases of information and that confidentiality is not breached. And also culturally responsive care, which is a major key point here if progress is to be made. And my next slide is about my references, and I have quite a few references here, and it basically speaks for itself on what was used in the slide. And with this, I have come to the end of this slide, given the specification and the short amount of time. I hope that the information here will be sufficient to support that. Thank you. And once again, my name is Valentine.